Hello, my name is Dr. Habib Dalhoumi. I am the medical director and the creator of Inspire Wellness. I currently have two San Diego locations, focus on weight management, hormone replacement, anti-aging practices, and some medical cosmetics. Today I want to focus on testosterone replacement therapy in men. I had an email today from a referral of a new patient that was interested in testosterone replacement therapy. Had a few questions for me via email. I thought it was about time that I put something on video, basically to discuss a lot of the current practices, the current ideas, some of the scientific literature, essentially what's available for men, and how to compare that with what you may be hearing from your doctor. I practice conventional medicine. I'm board certified in family medicine. I practiced family, urgent care, and emergency medicine for around 10 years here in the San Diego area. I started focusing on hormone replacement therapies and other wellness modalities about 5 to 6 years ago. So I have quite a bit of experience in both realms, what I would consider sick care management, as well as healthcare or preventative care or wellness medicine. Now I kind of call what I do sort of lifestyle medicine. It's sort of a new coined phrase. So I do want to talk about testosterone replacement therapy. I don't want to spend 10 minutes plus talking about it, but I do want to focus on the specifics. I believe that when men, and again, I mean, I treat patients in their 20s up until their 80s or so. So we're referring to men essentially in virtually any stage of their life. Typically men peak or have peak testosterone levels in their early 20s and slowly begin to lose that testosterone by the mid-20s is when things start to kind of decline. Usually in the 30s, early to mid-30s is when they start to decline, the testosterone levels start to decline at a significant pace. By 40 to 50, you may be looking at 50%, in some cases as little as 20% of the normal values or the values you had at your peak, usually in the early 20s. So it's imperative. You know, I recommend testosterone testing to virtually any man, maybe 18 and above. By the time you're in your early 20s, you've hit your peak. So it's a good reference lab to look at. We're living in a world now where we have so many endocrine regulators, our diet, some of the toxins, stress levels. It's a very different world that our parents, our fathers, or even our grandfathers lived in. So generation by generation, we're becoming more infertile with less testosterone production, less hormone production in general. Our glands are tiring earlier, and it's manifesting. I mean, it's become an obvious pandemic. Some of the symptoms related to lower testosterone, suboptimal testosterone. You're going to hear me use that term quite a bit. But briefly, testosterone is produced in the testes. Unfortunately, the term is testosterone. Women have about 1/10 of the dose and really need it. The actual receptor for testosterone is coded on the X chromosome, so we actually get it from our mothers, believe it or not. So it's really not a male hormone, and unfortunately it was named testosterone, produced in the testes, when a woman produces it in her ovaries as well as adrenal glands. So in any event, we do have approximately 10 times that of a female, and we need those values obviously for a number of things, a number of the secondary characteristics that a man has and what differentiates a man from a woman. What's important to know though is that by 40, a lot of men, like I mentioned before, have about 50% of what they did in the early 20s. And it's not become any more, I want to necessarily maintain muscle mass or gain or lose body fat or improve my overall well-being, my mentation, cognition, focus, motivation. I mean, those are the things that you'll see in a commercial, but it's really now based on scientific literature what the benefits of testosterone long-term are, and that is to protect your heart, to prevent or lower the risk for diabetes, for dementia, osteoporosis, wasting away, depression. I mean, it's extremely significant, not only the effects of testosterone today, but the effects tomorrow. And the research will show And I stand by this now. There are no increased risks of prostate cancer. The research will basically tell us that don't wait till it's too late. Don't wait till your levels are really low. You've got significant cardiovascular risk factors. You're diabetic. You're carrying a significant amount of excess body fat. Don't wait till you're in this category, because then when we give you a youthful hormone, a revitalizing, rejuvenating hormone, your body can't reverse disease, plaques on the vessels and whatnot. It's very, very difficult to do that. And that's where you have increased risks of untoward events like silent heart attacks or stroke or whatnot. So the research says address it at a modest or early age, or when you have symptomatology, or when you feel things are declining, maybe not quite the same as they were even 5 years ago. This for most men is going to be in the early 40s, sometimes late 30s, middle 30s, maybe some men, rare, but into their 50s and sometimes 60s. So I would recommend getting lab testing done as soon as possible. Monitor any symptoms, and maintain good optimal levels. Don't be satisfied to have levels in the 300 or 400s, sometimes even 500s. Some men need to be in 600, 700, 800s, 900s, close to 1,000. So being able to understand what a lab value means is one thing, but understanding how that lab value affects you is more important. So I would suggest, if anything is a question mark in your performance, your overall health, your well-being, that you get it tested. Couple quick things I wanted to mention. Risks of taking testosterone, extremely minimal. I discussed the fact that there is no increased risk of cancer. Of course, if you do have cancer, it's something we probably don't want to start. We do monitor a handful of different levels. I'm always looking at the prostate. I'm looking at estrogen levels. In some cases, I look at dihydrotestosterone levels. I'm looking at red blood cell counts, liver function tests. So there are certain things that we're looking at pre-treatment and during treatment to make sure that your body is ready for optimal levels of testosterone and can tolerate that. I had a few questions that I wanted to go over based on this email that I had just mentioned to you that I received. Quickly here, so I'm 55, still fit, still racing some. I have a younger girlfriend, so I want to do all the things that I possibly can to be my best. If I participate in HRT for a period of time and I stop, will my normal production of hormone return to its previous levels? This is a very good question. Typically, you're going to have a baseline level. So at 55, you're going to have a baseline testosterone. That may increase slightly, may decrease slightly depending on the day. If you're watching the Super Bowl, your levels may be up a bit. If you're taking care of your children or grandchildren, your levels may be a little lower. So typically, you're going to have a baseline level. When we optimize, we're bringing those levels up into a high end of a range, typically, so that you can actually experience the benefit. If you were to stay on therapy for 6 months, let's say, and come off, unfortunately, you're going to go back to your baseline, which is a moving target at this point, so that baseline is likely going to be a little bit lower. But typically, after 2 to 3 months of therapy and some certain things that can be done, you will restore your normal baseline testosterone levels. Different formulations. There are topical formulations, injectables, and pellets. I also place pellets. The difference between them, typically the pellet will last about 4 to 5 months or so. There will be a peak at around a month to 6 weeks, and then a subtle decline from there as well. So it's something you want to consider. Typically injections I recommend weekly. Some men I do injections for every 5 days, sometimes even twice a week, just to minimize the peak and trough effect. Topical testosterone is typically a daily application. There are a couple of variables there, so hair, sweat, a couple of things that can sometimes affect the absorption of testosterone on topical, but that may be a route if you have an aversion to injections or are not interested in pellet therapy. How often do you recommend injections? We talked about that. Is there more than testosterone that I might benefit from? And this is an excellent question. Other hormones to look at are thyroid hormone, which has a lot to do with metabolism, growth hormone, which is another popular hormone in a whole nother discussion in itself, but another hormone that you definitely want to maintain optimal levels of. Cortisol I look at quite a bit, especially if you've lived a pretty stressful life or you've gone through a major traumatic or stressful event. If you live a very high stress life, certain occupations, if you're traveling, so flying through time zones, those things can really affect the cortisol levels that are produced in the adrenal glands. So I do look at that sometimes too. And the cost. I think cost is an excellent question as well. I run a program where I typically do either a monthly or a yearly program. I have very few patients that will start testosterone therapy for a few months, get the benefit, and decide it's not for them. It's extremely important that you get a personalized approach to testosterone therapy. Don't get put on a protocol. Don't walk into a clinic where you're looking at a screen being treated by somebody on the internet or not even a medical provider. It's extremely important that you value your health and that you seek care with somebody that is qualified in doing so. Again, one thing is taking a level that is extremely low and bringing it into a low end of normal range. It doesn't take a whole lot of testosterone to do that, and there's a good chance you're not going to feel significant differences. When you get these levels into optimal ranges, it takes a little more medical etiquette to kind of get there, to understand your body, the differences between you and your friend and your father and your cousin and whatnot, because we don't look the same. We don't have the same body compositions. We don't have the same stressors. We definitely don't have the same genetics. It's extremely important to see a provider that can kind of understand that and can recommend therapy based on those specifics for you. So, but back to the pricing. I do an initial consult myself. Usually it's between $200 and $300. Kind of depends on the area of Southern California. And therapy, we like to put on plans, monthly plans. Essentially, all-inclusive therapy, including testosterone. Sometimes we do add another hormone called HCG. There's also another medication called clomiphene or Clomid, which can also improve testosterone levels without affecting baseline levels as well. Typically recommended in younger men or a specific population. But all-inclusive, somewhere in the $200 to $300 a month range. If you're doing some of these therapies on your own, you're purchasing your own medications, that's quite a bit less. But I would say be prepared to pay around $200 to $250 on average a month. So it's an investment, but it's an investment worthwhile. Again, not today, but more important for tomorrow, for your health, your disease prevention, and your youth maintenance. Again, Dr. Habib Dalhoumi, Medical Director of Inspire Wellness. You can see me online. My website here in San Diego is inspireman.com. It goes directly to my site. You can learn more information. I'm going to continue putting out videos for different forms and different therapies. Send me an email. I'd be happy to hear from you. You can call our clinic as well, 855-2-INSPIRE.